So I'm an ER doctor and I got a story you're going to love. Several years ago, I was working in an emergency department and I saw a gentleman in his 30s who came in complaining of a sharp, constant chest pain in the middle of his chest for 3 weeks. Now, he waited so long because he said that he didn't have insurance and he was worried about the hospital bill. I did an EKG when I saw him, and the EKG showed a pattern consistent with the diagnosis called pericarditis. Now, what this means is it's inflammation of the sac that surrounds the heart. Now, that sounds bad, but in most cases, it's actually a reasonably harmless condition, and we usually send people home with Motrin and it resolves on its own. However, he looked pretty uncomfortable and he was adamant that he wanted no further testing. So I negotiated with him and he agreed to stay in the ER for an hour or two just to make sure he was okay. Sure enough, about an hour or so later, I hear the dreaded call from the nurse. "I need help in here." Now, when you hear that, that means trouble. I ran to the bedside and I see 2 nurses doing CPR on him. "What happened?" The nurse said, "Well, he was complaining of increased shortness of breath, his eyes rolled back, and he stopped breathing and lost his pulse." So we continued resuscitation at this time. One of my physician partners went to the head of the bed and intubated him, meaning placed a breathing tube. After we give him a few medications, we stopped and checked for a pulse. Still no pulse. I look up on the monitor and he's in a rhythm called PEA, pulseless electrical activity. Now what this means is basically his heart has a normal rhythm, but it's not generating enough force to deliver blood to the body. So immediately I knew what was going on. So I reach over and I grab the ultrasound and stick it on his heart, and this is what I see. This is a cardiac tamponade. Now what you're looking at is the structure of the pericardial sac. The dark ring on the inside, that's inflammatory fluid that's accumulated, and the heart's in the middle trying to beat but not generating enough force because it's being squeezed by all of that fluid. This fluid needs to come out, and it needs to come out right away. So what do? I reach over and I grab this 50cc syringe with a big needle. I take this needle, I stick him just beneath the sternum. I advance the needle towards his left shoulder as I aspirate, advancing. Come on, hit the pocket. Come on, hit the pocket. Come on. Boom, I hit the pocket, got the fluid, lifted up. I pulled out 60 cc's of inflammatory fluid from his pericardial sac. I take the ultrasound probe, again, put it on his heart, and this is what I see. No more effusion, just a heart beating normally. We recycle his blood pressure. Now he's got a blood pressure. He will live. He will survive. He's admitted to the ICU. His pericarditis calms down over the course of a week or so. The fluid does not accumulate, and he walks out of the hospital alive and healthy. Follow along for more stories from the ER that you didn't know you needed to know.